I am here to help make sure we get started in a good, supportive, helpful way for our All Come webinar. This is our quarterly webinar for Oregon's 1115 Medicaid waiver. If you are here for our April session, you're in the right place. I am pressing buttons and talking, so we'll see how that goes. But we're so glad you're able to make it today. There's a lot of folks here today. I see over 100 already, and people are continuing to join. Let's go to the next slide, and I'll share some Zoom pointers for how we can make the most of this time together. We have our Zoom chat, which is a great way to get our attention, to ask a question, to share your thoughts. A nice thing about the chat is that it allows our presenters to continue their presentation while we collect things that we can talk about at the end. And it's also a great way for us to capture um, and continue to track things that maybe we aren't able to get to today, or, oh, am I echoing? Okay.
Jessica, I do not hear you echoing. Perhaps if that person does, maybe try logging off and logging back in. That can sometimes help.
Thank you so much. Yeah, that's another great use of the chat, actually, is let us know what you're experiencing, and you can also sort of help troubleshoot. Once I'm not talking, I will be able to help troubleshoot things in the chat. And so that's one of the roles I'm here to do today. We are going to, in fact, we are right now recording this webinar. So the content that we share today will be available to you and to your colleagues, and anyone else you want to share this information with, up on our public website for the 1115 waiver. And that usually goes up, I think, about a week after, within a week of this presentation today. We do also have live captioning today. There are two ways that you can access live captioning. You can click the button in your Zoom toolkit that says it has a little two C's and a rounded box. It says show captions. I'm also going to share, there is also a live a stream text URL. You can get the transcript there as well. Whichever works better for you, you are welcome to use today. Um, we hope that you all have we learn a lot together. We are able to interact and share. I am asking for folks who are not actively speaking, please make sure you're muted. And also the raise hand functionality is a really helpful way to get our attention, but also allow us to sort of make sure that we get through the information that we're here to share while also being a place where we can interact and answer questions and spend this hour together. I think that's it for Zoom meeting tips. So I will quickly go over the agenda and then pass it off to our main presenter today. We always start with a few slides about our 1115 Medicaid waiver, just to make sure we all have a shared understanding of what we're here to talk about today. We have some information to share about reentry healthcare, the health-related social needs implementation, some updates, talk about the benefit update project. These are all different things happening within our 1115 Medicaid waiver, with some time for question and answer at the very end. And that's my speaking part. I'll hand it to you, Steph. Thank you so much.
Great. Thank you. Hi, everybody. My name is Steph Jerem. I use she, her pronouns. I work at the Oregon Health Authority as the director for the Office of Health Policy and also serve as the Medicaid Waiver Policy Director. So if we could go to the next slide, please. I'm going to start with our standard overview and just talk a little bit about the basics behind what we're talking about today. So we're here to talk about the Oregon Health Plan, which is what we call in our state our Medicaid program. Medicaid is the nation's public health care program. And so that is public health insurance, healthcare coverage. Those are all terms we use for it. And it provides healthcare coverage for low-income children, teens, and adults who live in Oregon. Next slide, please. The Medicaid program is governed by federal rules that are set for every single state to provide Medicaid in their state in order to get that funding. However, states can ask to change their Medicaid rules to test out new ideas that would deliver services at the same price and get different or better outcomes. In Oregon, these are called, well, everywhere they're called Medicaid waivers. And these waivers allow us to waive certain rules in order to provide those services differently. So this is an agreement with the federal government. On the next slide, I will just share our current Medicaid waiver. These are the key changes of what we are testing in this current waiver, which is a 5-year time period. It started at the end of 2022 and will go through most of 2027. So the first big bucket of work is around expansion of Medicaid coverage, meaning that we have more people who are enrolled for longer. And you can see there are 3 different ways that we've been testing that out there. And then the second one is around expanded Medicaid benefits and services. So for the people who are on OHP, we're trying to offer new, different, better, or additional services. And so that includes health-related social needs supports. We've talked a lot about that in these webinars, including housing, nutrition, and climate supports, and outreach and engagement services. A limited set of services for people in a carceral setting 90 days prior to release. So that's jails and prisons in the state. We're going to talk about that today. Tribal traditional healing practices. These are specific services that are overseen by and initiated through the tribes and through traditional healing tribal-based practitioners. A new appeals system for open card and fee-for-service members, and there are a few currently uncovered services that will then become covered as well. So those are all the different pieces of what are in our waiver. Next slide, please. So we're going to dive a little bit deeper today and talk about the re-entry healthcare. This is also known as, we talked about this as our carceral settings work. Justice-involved population. These are all words that we've used over time, and we are really landing on the re-entry healthcare. So you are re-entering from a jail or carceral setting. So next slide, please. Our goal here is really to increase the positive health and social outcomes for individuals, for people who are incarcerated. Incarcerated meaning they are in a jail or a prison setting. And as they transition out of those settings, how can we support them in their health and social needs? So right now, this current slide in blue, people who are incarcerated do not have Medicaid. They don't have access to it. So once they go into a jail or prison, people lose access due to federal law. And then when they're released, they have to go through the actual application sometimes, or have to be re-enrolled. And so there's often a gap in coverage right as they leave the prison or jail setting. That gap in coverage can then decrease access to the healthcare, difficulty in getting access to providers they may need to see. They may not have the medications they need. They may have difficulty getting the medications. Even if they enroll, they then may have difficulty in getting access to a provider quickly. And so it can increase the likelihood of negative health outcomes. So the goal here is that in the future, people who are incarcerated will then actually have limited Medicaid eligibility. So we'd close that coverage gap in between when they're released and when they are enrolled in Medicaid. It would promote that continuity of coverage. So really, they would be able to, as soon as they are out of a facility, be able to continue with services that they need to have. This would especially reduce health equity gaps in Oregon, and it would reduce the additional social and financial costs. There's a word called recidivism, and that's a word that we use a lot. It means the tendency for someone who has previously been involved with the criminal justice system to then have another encounter. And we really want to reduce that recidivism and other negative outcomes by being able to really support someone as they are exiting a facility. That's something that that's one of our overall goals of this waiver, is to really help people through their transitions of care and across different care settings. Next slide, please. This is dense. There's a lot of information on this and kind of more technical, but the goal here is to just say there's actually two parts of what we're doing here. One of them on the right-hand side is overseen by the waiver, as I just talked about. But on the left, there is also a federal bill that is asking for something very similar across the whole country for youth, for young people who are incarcerated. And so this is launching next year, and it is to support youth under 21 and former foster care youth up to age 26 with some additional services as they leave any type of carceral setting. So we're kind of combining with our work. We have this requirement from the federal government for youth on the left. That's called the Federal Consolidated Appropriations Act, as well as our 1115 reentry demonstration waiver. So the pieces that I talked about our goals for the waiver, which includes additional services, additional adults, and adds other benefits as well. If you have questions, feel free to put them in the chat. I do feel like this is a lot of information. So you may be wondering, next slide, who will be impacted by this? We have people who are going to be in custody at a facility that offers these benefits. They have to also be eligible for OHP based on income and other requirements. And they are going to be released from that facility, from that setting, within 90 days. And then there are three ways that a carceral facility, so this is a jail or a prison, may decide to provide services. So that can either be through their own facility. They may employ a provider directly or provide those entry services that we're talking about, making sure that you have your medications, making sure that you can be enrolled, support them in getting access to care. Contracted healthcare providers, so the jail or prison may contract with others to provide those services, or they may be contracting with community providers who can support that within their own community. I do see a question here, as it is limited Medicare for people, it is who are incarcerated, is this open card or local CCOs? So it can be really tricky to remember. Medicaid and Medicare are slightly different. Medicaid is for low income. That's what we're talking about here. Medicare is for older individuals or those with disabilities. So we're talking about Medicaid right now, and it will include both open card and the CCOs as partners in all this work. Great question. Next slide, please. So this map here shows us which carceral facilities, so again, prisons and jails, that will be eligible to participate in this program. So if someone is incarcerated into one of these facilities, then they are able to participate. And these are the locations of all the eligible facilities. So you can see as they're distributed across the state. The blue dots are adult county jails. The 11 are county youth detentions. The yellow are youth correctional facilities overseen by Oregon Youth Authority. And then the purplish pink is a state prison facilities overseen by the Department of Corrections. There's a question in the chat that the carceral facility has a choice in how to provide. Is there a requirement that this coverage must be provided? Great question. For the FCAA, so the federal required coverage, the one that I talked about, it's youth focused. That one is a requirement of all facilities who serve those individuals to participate. Our waiver is not a requirement, but we have a lot of interest in building on the work from the FCAA work to be able to partner and build on that together. We are working really closely with the Oregon Youth Authority and the Department of Corrections to support the interest, and we have a lot of interest from county jails and sheriffs in participating in this program. So it is not a requirement. They're a completely separate system, but there's a lot of opportunity and improvement for people who are incarcerated as we build the partnerships between our systems. And so I think there is a lot of genuine interest in doing this work together. Next slide, please. The potential eligible population, you may be curious about like, how many people are we talking about here? So this is data that we talked to all of those different facilities in 2024. These are estimates, but to get a sense of what that looks like across these 4 types of facilities on the left is our totals here in the red box. And so you'll see most of the work will really be done with adult county jails. That's the largest number of releases to the community. But you can just see the spread here to get a sense of what that looks like and the length of stay. Really interesting information. Next slide, please. So just to really think about this from the member experience, so somebody who is in the Oregon Health Plan and then, ends up in custody. Some people may not actually even be in custody long enough to receive these services, or there may be a completely unknown release date. So like if it's less than 48 hours. So these are called short-term stays. And this is one of the challenges that we've just been wrestling with as state agencies to try to think through who is actually going to receive these benefits. Any of those short-term stay facilities in counties, they will, that's a really confusing sentence as I see it here to try to describe. They will be more likely to use less than the full 90 days of benefits. But that means just that we have 90 days to serve someone. And for a lot of people, they may not even be in for 90 days. And so that's partly what we're looking at. In those longer term facilities, Department of Corrections, state governed facilities, they will likely be using that full benefit for that 90 days. And so one of the things that we've tried to do is how do we put all that together and create a program that's really going to serve everybody and what their needs are. And so the blue box here just talks through how we are going to develop that model to help manage the short-term stays in addition to supporting those longer-term stays. And how we're working with the Open Card program as well as the CCOs to really be able to support someone in the short term with getting access to benefits and then connecting them to a CCO. Yeah, and I really appreciate the note in the chat. There's a real problem for people who have short stays. They go in and get kicked off OHP and other services and then struggle to get back on. That's exactly the gap that we're trying to address here, is the disruption of services can really snowball into negative outcomes, and we want to prevent that as much as we can. And so we are going to be working with those individuals. They'll be enrolled in Open Card to be able to just get them quickly onto the program, make sure, especially if they're in a short stay, that we're going to be able to support that and then ensure the connection to the CCO in the longer term. Next slide, please. This is the planned timelines right now for reentry healthcare. There are multiple cohorts. We talked about, there's an opportunity and a there's not a requirement for participation in some of these. And so we're going to be supporting facilities and doing a cohort approach, meaning that we'll do groups at different times as they are able and ready to participate in the program. Our timeline here really stretches across 25, 26, and 27. Trying to understand from the facility perspective, from the state perspective, there's a lot going on federally, like how to support different facilities in launching at different times. And so these are proposed timelines at this point. And we're trying to determine, where we see good start dates, where it would work with the facility, and would likely be on a rolling basis as well. So no sooner than 2026, but we'll see how things go. And there may be interest in shifting later as needed as well. We're really bringing together two enormous systems, and the work can't be understated. Like there's a ton of work in getting our systems to work together, electronic health records to work together, community information exchange. There's really just quite a lot of work behind the scenes to make this a reality. Okay, so next slide, please. If you're interested in this, if you want more information, we do have this website here, and that can either be for just general information or for someone who may be a provider or a facility. We also have an email address here for any questions that are specific. And then I'll just pause in case folks want to ask any questions, and then we'll move on to our next big topic for the day. Okay. Could we please go to the next slide? We're going to talk and give an update on health-related social needs services. That's our HRSN implementation updates. And thank you, Jessica. I saw you just put those links in the chat as well for people to click on if they'd like. So as a reminder, our health-related social needs, these are social and economic needs that affect a person's ability to stay healthy and well. And in our waiver, we have some eligible people on OHP who can get those services that are supposed to help them improve their health outcomes. And that includes things like rental assistance, tenancy support, changes to the home during extreme weather, such as air conditioners or air filtration devices, changes to the home for safety, like a wheelchair ramp, nutrition benefits, outreach and engagement services. These are all rolling out at different times. We've been working with the community to understand how to support this rollout and this growth in services in our state. Next slide, please. We do have an update on our HRSN webpage. We just wanted to let you all know that if you are looking for what we've been calling our climate services, to more align with how this is laid out in our federal agreement, we've brought the climate services under the housing benefits. So if you're seeking those out, that's where you'll find them. Nothing is changing. It's just more in line with how those are described in our actual waiver. And when we rolled out the climate benefits, it came before the housing services. So that was why we differentiated them initially, but now that we've been getting everything going, we really wanted to get that more aligned. So if you're looking for those housing benefits that are home changes for health during extreme weather, you'll find it there. Next slide, please. And here's more. So it says here, home changes for health during extreme weather. You'll see that link will take you to the webpage for air conditioners, air filtration devices, and other home changes. Just wanted to make sure we highlight that. And then next slide, again, more on the webpage. Just wanted to make sure it's all the same information. You can still find everything that you need. It just reoriented a little bit. All the original links, everything still works. Okay, next slide, please. So where are we with our rollout of health-related social needs services? In March of 2024, Over a year ago at this point, we had the home changes for health, such as air conditioners, filtration devices, and some outreach and engagement services launched. In November of this past year, we launched a number of the housing benefits, as well as expanded our outreach and engagement services. And then in January of this year, we rolled out some of our nutrition benefits and also launched the Young Adults with Special Healthcare Needs expansion. We are continuing to seek to launch more benefits and make ongoing programmatic improvements. So for example, the fruit and vegetable benefit for nutrition. So there are different pieces that we're continuing to try to roll out as we get going and as we understand the readiness of the state to be able to absorb additional services. All of that is really based on our ongoing evaluation and monitoring of our current programs and considering whether updates are needed to those that have already been rolled out, as well as timelines in the future. So just wanted to let you know as things get landed more, we'll continue to share details whenever available. Next slide. This is just another statement on our home changes for health. These are really to help keep people safe during extreme weather and wildfire smoke. These are the air conditioners, heaters, and air filtration devices. These help provide clean air and healthy temperatures. We have mini fridges for keeping medication or breast milk cold, portable power supplies. And where we're at now is really prepping for our second summer season with this benefit. It was hugely helpful last year. We continue to see the success of that and really want to aim for prevention wherever possible based on somebody having a clinical need for these devices to keep them safe during that extreme weather and wildfire smoke. Next slide, please. This demonstrates just our lead up to summer last year after our launch. I think so we saw the number of devices really escalate, especially in that, May, June, July time period where people needed to see that distribution. And then we saw, so that was a 52% rise from June to July. So CCOs and our open card members should be benefiting from a year of this under our belt and really looking at early and proactive member screening to help with that seasonal request in advance. Let's see, if minors in the household are on OHP, but the adults are not, can the family still request things like air purifiers? Yes, they can. So the only important component is that in order for someone to be eligible, they have to be on OHP. And then they also still have to have a clinical risk factor. So if the child is on OHP, they would have to be the one demonstrating a need, asthma related, or there's many risk factors that demonstrate, I wish we could just give everybody an air filtration device based on smoke, but it does have to be aligned with our eligibility. If they're not eligible, we have a great web page that kind of shows the other county services or other state services that try to aim to do the same type of support as well. We'll talk about housing in just a second. And then there's a fruit and veggie benefit. And I don't know if we have anyone who could speak to the fruit and veggie benefit, but we'll see if we can drop something in the chat to help discuss that. So let me finish up with this, and then I'll get to the question about housing as well. Yes, the climate device, they also need to be part of the covered population. And they do not have to be at risk of homelessness. That is correct. The at risk of homelessness is actually an entire category of eligibility, but there are lots of other ways that somebody could be eligible outside of being at risk. That at risk of homelessness only comes in for rent-based services. Shauna, do you want to speak to the fruit and veggie benefit for a second?
Oh, good morning. Absolutely. Just real quick, fruit and veggie benefit will really be providing fruits, vegetables, culinary herbs to members. We are trying to get everything in line so that we can really describe the benefit better over the next couple of months. We'll also identify when we'll launch. So right now, our estimated time is between October of 2025 and June of 2026. So our goal is to be able to have a launch date, so then we could kind of fill all the details in around fruit and veggie benefit. Um, but it's going to be to any of the health-related social needs eligible populations who also um, uh, are positive or positively screened for either low food security or very low food security. So more information to come on that.
Thanks so much, Shauna. And I see the note here from Holly in the chat that in Eastern Oregon, we are seeing a gap in terms of very few dietitians available, and the few out here have no idea about the benefits. So we're helping to connect dietitians with the CCO to get trained on the assessment that is required. Really appreciate that on the ground hand holding and connection that you're doing there. Um, I think that's part of what all of this waiver is really testing is our ability as a state to help provide these services that are outside of the doctor's office in a new way. And so appreciate that. Okay, and so I'm just going to finish this up and then let's pause for some conversation about housing. The next slide, please. So the housing benefits, as a reminder, this is rent, utilities, and changes to the home for safety. It is aimed to help people stay in their current housing and to prevent homelessness. This can provide rent for up to 6 months, utility costs, storage fees, other housing tenancy services, um, and changes to the home for safety reasons. So that went live in November. So I just want to remind folks we are not even 6 months into this program. I think we have seen challenges for sure. I see a question here about delays in making the needed payments for housing supports. They've been approved and haven't received anything and are facing eviction. We are working very actively with CCOs on the challenges that we're seeing here. Um, I don't know if anyone else, if Jesse is on and wants to speak more about any of that. And if not, I will speak a little bit. Or if anybody else before I jump in. Okay. Um, Really appreciate you lifting that up. I think one of the challenges that we have worked through or are working through is the difficulty in supporting everyone. There's a lot of need at the same time in our state right now. CCOs have been doing a lot to try to identify folks who are at higher risk first, but then the time it takes to sometimes get through that results in continued waiting time for other people who have applied. And so trying to support how to streamline some of that work. We are also in the process of distributing our second round of capacity building funds, which can support additional hiring to be able to make up for those challenges as well. Um, and I think the other piece is that this benefit was never designed to prevent eviction. That last time period right before when someone has an eviction notice in hand, how quickly someone and a CCO need to act in order to prevent that eviction is not something that a Medicaid system is well designed to do. And so we had really wanted this benefit to be more preventative than that. And I think what we're seeing is that there is need, and CCOs are attempting to do that, and it is really difficult in the time frame that we have. So, looks like Misha, would you like to add to that as well?
Yeah, thank you. And thank you for addressing this. I think Well, one thing that I don't understand is who is responsible. I mean, the people that I'm aware of, they've been approved. They've spoken to their landlords, and the landlords have attempted to be patient, but no checks have been received. And who is responsible? Is it the CCO who should be writing this check? Are there other entities that the CCO is passing on the information to? I'm just really uncertain about literally where the buck stops in
Yeah.
terms of responsibility. And I'm also concerned that there are too many layers to the bureaucratic process to make this work. If people, it was preventative, but 6 months down the road, it's no longer preventative. Now they're in crisis. So if it was meant to be preventative, it's not working in that function either for way too many people. So um, yeah, if you could speak to where that responsibility lies. I don't feel it's necessarily with OHA, but where who is supposed to be writing those checks once it's approved?
Yeah, great question. And I will just say, I mean, we are very actively working through this ourselves as we understand the problems that are happening on the ground. It depends on the CCO and the agreements they have with the organizations. So in some cases, depending on where you are in the state, it will be the CCO writing the actual check to the landlord. And in other cases, the CCO has contracted that authority out to the housing provider. And I that's what we are working through right now as well, is like, what is that flow and how can those checks be cut faster? And the expectation that is happening faster. So I hear you. We know this is a problem, and we are really honing in on where this is happening and why it's happening, and trying to get through that barrier right now.
I appreciate your speaking to it, and I'm grateful for anything that OHA can do to sort of move that process along. I mean, I know it's not OHA who's meant to be writing those checks. It's someone else's responsibility, and I don't know how you hold them to it, but thank you for your work on it.
Yeah, I appreciate that, and definitely very active conversations about that as well, to try to push that faster, especially for those who have been approved. I think there's another question in here about that I see was answered by someone else about the formal rental agreements, and there is a great solution that we have some templates to support something being written down. Doesn't have to be a formal lease, but something being written down about the agreement of that person being in their housing situation and at risk of losing that housing. And then the challenges in funds and acknowledgement of applications, misunderstandings on what is authorized versus approved funding, and the responsible entity. So thank you for that. We'll definitely bring that back to our team, who's, again, actively problem solving this. We work multiple times a week. We're gathering all the CCOs together to work through the problems that are being lifted up. So hearing them is really helpful. We can make sure to understand like which our CCOs aware this is happening. How are they solving it? Do they need us to come in and be a little bit more heavy-handed, or are they already working on something? Yes, Chris.
I wanted to ask about specifically documentation requirements for utilities. A lot of HRSN rent and utility providers in our area are having a real trouble getting the documentation required, month by month utility bills. Maybe you've heard this before. Is there any way that OHA can make those more flexible? It's in many cases it's taking like hours per client served just to get the required documentation to pay the utilities.
Utilities is another one that we've been trying to work through as well. Let me check in with the team. I'll bring that to them as well. Thank you for lifting that up. I think that is the documentation has always been one of the challenges in how we get to that utility. And really wish there was a streamlined way. I think there's a lot of things that we're learning along the way with this that demonstrate the reality and the difficulty of our members in navigating these services and systems as well. So thank you. Yes. Adriana?
Yes, thank you. My question is, and this is because I have a case that I'm working on, that has this, I wouldn't necessarily call issue, but how does HRSN navigate through um, two requests under the same household for HRSN benefits? So just to give a little more context, I have two clients who live under the same household, um, and they both submitted an application, and she was approved for the rental assistance. And he also, so the other person rents in her home as well, and he's backed up on rent, but he also needs a storage, help with the storage fees. And so I was told by one of the workers that they would treat this as separate households, even though it's one address, because, they don't file taxes together, stuff like that. And so I haven't received a response back from the person who's trying to apply for the storage fees. I know that to be able to access the storage and utility and all that, you have to first be approved for rental assistance for the housing benefits. So, yeah, I don't know if y'all can give me like an answer. I've been trying to reach out, but nobody's messaged me back. And so the client is kind of, he's been reaching out and asking how that's going because obviously his storage fees are going up.
Okay. So if you have two members who are in the same household but are not connected, like in the Medicaid system as a shared household, then they would be treated separately. It also includes that they would have their own portion of the rent covered. So it would not cover the whole amount of the rent for both people. It would just be each individual rent if they're both at risk of losing that housing. And then the storage should be able to be supporting that individual. Storage can be a little tricky sometimes because it may be that they need to be undergoing a home renovation and that storage is supporting their, like moving of household goods and storing them while there is a ramp being built or something like that as well.
Well, in his case, he was recently released from incarceration, and so
I see.
he needs, obviously the place where they live doesn't have enough room for him to be able to store all his stuff, so that's why he has this storage unit.
Okay.
And so I don't know.
Anyone else on the phone able to problem solve in the moment? And if not, if you can just drop your email, we can try to connect you to the right folks. Let us know what CCO you're working with too. That would be really helpful.
I'm with Eastern Oregon CCO.
Okay.
Hey, Steph, this is Charissa and Adriana. I'll reach out to you directly. I actually think I have your email. So, Steph, thank you, and we can problem solve offline. I really appreciate you bringing this up.
Thank you so much. Okay, Laura.
Hi, thank you so much for calling on me. So I think one of the things that people in Multnomah County are really struggling with is like so I have transitional houses and we've taken people in who are supposed to get HRSN benefits. And so we're not only at risk of like the members becoming homeless, but every month that goes by, we're falling farther and farther behind. So we're at risk of closing transitional houses for families. So I really the impact is huge. So the other thing is that when we have clients call, they're often on hold for hours. And then when they get through, I had somebody last night who was made, their appointment is in May. And it's April 9th. And so I just feel like there's a bottleneck somewhere. I don't know if it's with, I'm not going to name anybody, but like I don't know if it's with the people who are doing the initial applications, but there's clearly a bottleneck somewhere. And so we've had applications in since November 1st, and it's November, December, January, February, March, April. So we've been holding people expecting payment for 6 months. And so the unintended consequences is that we're losing beds for and people are having to close houses in my community.
I really appreciate you sharing that and the situation that you're in. It's really helpful for us to understand the scope, and also will, carry this specifically to our Multnomah County CCOs, and we are problem solving some of that bottlenecking. It is like the balance of this is a new program, and also the need is so intense in our state, and needing to support people is a very real issue and situation. And it can't just be that like our program is new and we're getting up to speed. So trying to balance what that looks like in reality is what we're working through right now. And we will share as soon as we can with any changes to the program or how we're approaching this as well. I know that there have been some proposals that are being discussed. So thank you for that. I am going to move us to the rest of the slide deck. And also, if you have other things to add, please feel free to continue to use the chat. We will capture that information and try to answer questions in the chat as well. Okay. So just some notes about November and December. We know that we had just under 800 members authorized for at least one housing service in those first 2 months, which I realize barely touches the need in the state, and also is 800 people that we haven't been able to serve through Medicaid before. And so we are really trying to support the need, understand what this looks like, recognize this is a demonstration project, recognize that we are trying to see what this looks like to bring Medicaid and housing closer together. Next slide, please. So just an update on the Community Capacity Building Funds grant program. As a reminder, these are funds to support organizations in the state to become a provider of the HRSN services. The funds themselves are managed through coordinated care organizations in the state. These funds support organizations that intend to become HRSN providers to develop what they need to support those members. And the funds can also support entities that are going to be hubs of others. And so you may be supporting multiple small organizations in their billing, for example, and so that can support it as well. The CCOs are administering this grant program. This is our second of 2 years, and they will be reviewing the applications and awarding funding. Applications can be submitted between April 1st and May 30th, and more information is available on our webpage. Next slide, please. These are examples of the types of organizations that we've seen in the past and are eligible to apply for these funds. And so these are community-based organizations like a housing agency or a food and nutrition provider. It could be an organization that either is providing or intends to provide or coordinate the benefits, so like case management or local government. And it could also be organizations that support different parts of the HRSN network. So like maybe an entity or organization that provides administrative or billing or training supports to an organization providing services. So, in reference to our earlier conversations, this is where we're going to see some ramping up of, ideally, some ramping up of hiring to support more of the types of services and needs that you're all talking about. Next slide, please. These are the allowable uses. So it includes technology like new billing systems, workforce development, so staff salary for up to 18 months, trainings, other supports that they need for workforce, development of business practices like designing of a new workflow, and then outreach and education. Like an example here would be launching a new learning collaboratives. These are very specific uses. This is an agreement with the federal government about how the dollars are used. I think there was maybe some surprise last year that it wasn't more like, here's what we think we could do. Can you give us funding to do that? This is a very specific grant program for these 4 allowable uses. Next slide, please. Here's our key dates. And so in 2025, there is a web page here about how to become an HRSN provider. There is the website went live March 3rd. You can apply now because the applications are open from April 1st to May 30th. That deadline of submitting the application and a proposed budget to the CCOs is by May 30th. You're welcome to reach out to the CCOs and talk through what you're proposing, see if they have any other suggestions as well. We'll be providing the notice to the grantees by September, and then funds will go out between September and October. Next slide. And so these are some important resources. We have that web page that has all the information you need, as well as the specific email address if you have questions. I also know we have some of our experts on the line here as well, if there are any questions that are popping up about CCBF. Oh, thank you, Suzanne. You got that in. Okay. And just a note to staff, since we are short on time, if you are able, it looks like people are already jumping in, but if you're able to answer questions in the chat, we would really appreciate it. Next slide, please. And I'll just run through our last topic here. So just an update on the Benefit Update Project. So the Benefit Update Project, the most important takeaways here is that this is a change. It's a project to change how our OHP benefits are organized. And so it means that OHP, the Oregon Health Plan, will cover all the services that federal law says are mandatory and that Oregon says are medically necessary. And so this is really more of an administrative change about how services are described and laid out rather than a change to how any of the services will be delivered. No members will lose services as a result of the transition, and we'll actually see some services that aren't covered today being added to the benefit package. So those are the key takeaways. Next slide, just to share a little bit more in detail here. You may be like, well, which services are being added? So as part of that Oregon, through the Oregon Health Evidence Review Commission, known as the HERC, they will be determining which services are what's called medically necessary through its public process. And so HERC will recommend which new services should be covered by the Oregon Health Plan. We expect that there will be a small increase in the behavioral health benefits. We expect some new physical health or medical and surgical benefits and no change to the dental benefits. And then we'll also see the fee-for-service Pharmacy and Therapeutics Committee looking at some medical changes that are not covered. All this would go into effect January 1st, 2027, and is part of the shifts due to our waiver as well. And if you are curious, on the next slide, there are lots of ways to get involved in this more. So if you are really wanting to understand if HERC can review certain additional benefits, you can email those suggestions to this email address. You can also participate in the HERC public meetings. They have a website, they have a whole work plan of what's going to happen in review over the next year. And that's the same for the Pharmacy and Therapeutics Committee. And then our benefit update or BUP webpage also has lots of information about what I'm talking about and more in-depth FAQs as well. So with that, we really only have 2 minutes. I know that there was a lot more popping up in the chat, which is great to see that engagement. And I don't know, Jessica, would you like me to read some of those out loud? Would you like us to just close out with folks? What would you prefer here?
We are just about out of time. I think there's a little bit more content, so maybe I can run us
Oh,
through
yes, please.
just
Yeah.
the
Oh, sure.
general way we
Finish my
close.
section. You have your section.
I do want to say something, which is that there's a lot in the chat, and we are not going to be able to cover it all in a minute or two. I also want to let folks know, because we are recording this and it is a public forum, we're going to try to keep away from really specific case information that might accidentally become identifiable or anything like that. We are transitioning this webinar series to quarterly, so I want to make sure that you all know that we will be back on July 9th and also October 8th, but that there are other ways of reaching us in between, and especially as it relates to finding specific solutions for specific situations. Let's make sure that we keep open channels to do that elsewhere. We have shared the 1115 waiver.renewal email address as a great way to get our attention if you're not sure how else to reach out to us. We'll continue to put information like today's session and future sessions, as well as our newsletter and other information on our website. And we do have a public mailing list that I think it's every 2 weeks, information goes out. So I want to make sure you all are aware of that. And watching a lot of things continue to happen, and we're right at 11. So I'm going to not try to address further questions, but just know that if you put something in the chat, we are recording it. And for a few folks who have reached out with specific situations, if you make sure to get your contact information to someone at OHA who is here offering to help you. We really appreciate you continuing to participate and share really important questions, concerns, updates. We really do appreciate your partnership. I'm doing the thing where I talk and try to look for something at the same time, but I do want to make sure you get the sign up URL for the newsletter. So I am dropping that directly in the chat right now. Whew. And thank you, Steph, so much for presenting and for working really hard to make this interactive and to be very responsive to folks throughout the presentation. There was a lot to go over today.
Thank you, Jessica, and really appreciate everybody who is doing all the hard work on the ground right now with this program. I know that there definitely have been bumps and hiccups, and we are working through it and see you all as partners in elevating this work and identifying the challenges and coming up with solutions with us. So thank you for that. Thank you for your time and commitment and willingness to do this work and to volunteer your time on days like this as well. Please reach out with additional questions, and we'll see you next time as well. Thank you.
Thank you. Bye.